profile interview segment this week, I'll be speaking with the President of the Medical and Health Workers Union of Nigeria alongside the Secretary General of the Union. They both will be sharing their expectations from various stakeholders in the healthcare sector as regards the well-being of their members. It's good to have you on the program.
Thank you very much. My pleasure having you.
Yeah, so talking about the world of work, when it comes to the health workers, there are reports of infectious diseases around us as we speak, not just in Nigeria, but in Africa. When it comes to the welfare of health workers, as a leader of workers, what would be your recommendations to government and relevant stakeholders in the industry?
Thank you very much, Sharon. I think let me begin by saying the issue of infectious diseases suffixing in Africa is very natural. There is no way you can do away with infectious diseases. Professionally, we call them communicable or transmissible diseases. Once there is a life, human life or animal life, there must be an issue of diseases. Coming to the issue of what relevant governments will do to address the issue, I think this is a very, very serious one because our government tend to be very lazy in aspect of health sector. You can agree with me that a reasonable portion of percentages is coming from donors, while I think if there is any health challenge, before you know it, international bodies are donating a reasonable amount of funds to probably address the issue. So what I'm trying to say is it is high time for government at the African level or region to be on their feet financially. You can also agree with me just of recent, I think the President of the United States of America decided to opt out from WHO, which there is no way it might not affect the health system in African countries because America is playing a very significant role financially, materially, and even with equipment to help African countries to address their health system. Therefore, it is a high time for the African leaders to start somewhere. Then on how to address it, this issue of welfare or good packages of health professionals must also take a look because now if you take a instance of Nigeria, so many health professionals are moving outside the country, which I assume we call it JAPA of health professionals. That is causing a lot of harm, that is causing a lot of injury to the healthcare delivery in the country. So I think the welfare of the health professionals need to be readdressed with all seriousness.
Talking about adequate infrastructure, would you say that we have enough infrastructure in place in the country? And what more needs to be done to ensure that the workspace is safe and decent for an average worker?
Well, I think if you talk about African context, it's a broad discussion, but let me probably talk about Nigerian context. Well, I think it's very alarming and disheartening. If you go to any of the community now, you can see overcrowded population of patients that are going to that hospital to access healthcare services. So to me, even the hospital infrastructure is not even enough. Then talking about the manpower, you will agree with me, most of these hospitals, they lack manpower. Is looking at the WHO provision that each and every doctor is supposed to, medical doctor is supposed to see a patient of 200 per day. But nowadays, I am very much sure none of the medical doctor is seeing patient not below 500 in a day. And I think this is a very serious issue. We need to take it with all seriousness. Then the issue of 3 tiers of health system. Government must pay positive attention to the primary healthcare health system. Once primary healthcare system was given proper attention, I'm very much sure even the secondary and tertiary level will not have much difficulties, because most of the cases going or looking at tertiary hospitals are primary cases, which are, if they were taken care in an appropriate way at the primary level, I think there is no need of going to secondary health system and even tertiary health system. Then I think the issue of training at our institution, health and medical institutions also need to be adjusted, because the world is changing globally. And I'm very much sure if you take a look at most of our curriculum now, I think is very, very quite challenging compared to what is happening in other parts of the world.
Recently, the president approved an extension of retirement age for healthcare workers from 60 to 65. What's your take on this? Owing to the fact that we know that we have lots of health workers that migrated out of the country, and we still have to keep some of this experienced hands in the system.
Well, thank you very much. Let me start with the issue of extension of age retirement of health professionals by the federal government. I'm not bragging or rather proud, but Nigeria is blessed with a talent that you can't compete with Nigeria in all other countries in the world when it comes to issue of intelligence, when it comes to issue of talent. I can tell you, go to US, one of the biggest hospitals are managed by Nigerians. So I think when it comes to issue of talent, we are blessed, we have them, and God has provided for us. Then the issue of age retirement, to me, is a very welcome development, because health system is a system where you need to groom those who are coming up. For example, if you have 10 medical doctors that are retired, that are engaged or employed for 20 years, the experiences, the skills they acquired in the process of the daily service delivery, I think cannot be compared with the one that probably employed 5, 10 years. And most of it is not about theoretical aspect, it's more a practical aspect. Therefore, those that has the experience, those that have the skills, honestly, they need to be in the system. Then secondly, the issue of retirement, you will agree with me also, anybody that attend 35 years of working experiences, that is when he has the full technical know-how of that profession. But once in the health industry, if you elongate it to that period, it will enable that personnel to give or to groom up those who are coming up, and I believe the health system will be better. Then issue of migration to outside the country, let me be honest with you, the basic factor is about welfare or the packages that Nigerian government decided to pay to health professionals. Once there is a better package, everybody will decide to remain in his country. So I think let me use this opportunity to call on federal government as a matter of urgency to do everything possible to adjust as well as improve the welfare packages of health professionals.
Thank you very much for your time.
Thank you.